Fibroids, a problem for so many women. Experts think as many as 20 to 40% of women 35 and older have fibroids that are large enough to cause pain and pressure, and almost half of African American women have them. But what are they, and how do you get relief from fibroid pain? Fox 5 medical team's Beth Galvin is here now with some answers. Good morning.
And good morning, Karen. You know, there are so many sort of myths and misconceptions about fibroids, that they can lead to cancer, they can't, that they only affect certain women, they don't, and that the only option is a hysterectomy, which is taking out a woman's uterus. So we thought we would try to clear the air by talking to a woman who has spent most of her life battling fibroid pain until she finally found a way to stop it. Michele Arbet was diagnosed with fibroids at 19, and for more than 20 years, they left her in so much pain. She would sometimes tell people she thought she was dying.
And everybody thought, oh, you're dying from a period? No one believes how painful this is. When you stand up, you feel like you have a 10-pound bowling ball in your uterus, in your stomach, and your legs ache, your feet ache, because everything constricts.
Michele finally got help from Dr. Levy, an interventional radiologist at Northside Hospital where she works. Levy says fibroids are non-cancerous muscle tissue growths in a woman's uterus.
And they can form like a little ball, okay? And that ball can be the size of something, you know, the size of a fingernail or even as big as a volleyball.
You're suffering with pain, heavy bleeding, and pain and heavy bleeding, and it's horrible. It's a horrible thing. And the myths are, of course, that it's only affecting black women. This is a woman's disease. It does not matter what color you are, what race, what age. It is a woman's disease.
Weight gain can worsen fibroids, but Dr. Levy says your biggest risk factor is a family history of them.
So if your mother had a fibroid, if your aunt had a fibroid, if your sister has a fibroid, you're more likely to get fibroids.
Michele had 3 surgeries to remove her fibroids and a 4th procedure to try to relieve her heavy periods, but she says nothing worked.
Because they were all over the place, and they're just the meanest little things ever. They just suck the life out of you.
So 6 years ago, she tried one more time. Dr. Levy performed a minimally invasive procedure known as a uterine fibroid embolization, or UFE, using tiny beads to block off the uterine blood supply feeding Michele's fibroids. Today, the fibroids and the pain are gone.
I'm wearing white, which is nothing that I would have ever done 6 years ago, because there's no way in the world I would have been able to do that.
And women with severe fibroid pain like Michele have 3 treatment options. They can have a fibroid embolization like she did, or they can have a myomectomy. That's the safest option for a woman who wants to have children, where they take out the fibroids but they leave the uterus intact. Or a woman can have a hysterectomy, and that's surgical removal of the uterus. Fibroids are most common in women in their 30s and 40s, but once women hit menopause, they typically begin to shrink. So that's good news for women trying to hang on. Karen, I'm one of those women trying to hang on. Come on, menopause.
That's funny. So how do doctors diagnose it, fibroids?
Well, you know, when you go to your female doctor and they do a pelvic exam, that's what they're feeling for generally, is for fibroids, you know, and other issues. So they may do sort of a hands-on exam of you, and then if they really suspect there may be a problem with fibroids, they may order an ultrasound to take a closer look, or an MRI to take a closer look, sort of see what's going on inside your uterus.
So I know if you have a hysterectomy, the chances of fibroids coming back, none. But if you have a myomectomy or UFE, can the fibroids come back?
They can come back, and it may not work, you know, for women who have larger fibroids. Some of these procedures may not work so well, like the embolization. So, you know, it is something, but usually, typically, it's going to buy you a few years of comfort. And if you're already kind of closing in on menopause, that might be a good idea to go ahead and get treated so you're not living with this monthly pain, because for a lot of women, it is tough stuff.
And I don't think people caught in the story for her to wear white again.
Oh, yeah, I know.
Huge.
Women all over Atlanta were like,
I get that. Yes.
She can wear white.
She can wear white.
Yes.
All right, Beth, thank you for that.